While moderate tea consumption is generally associated with numerous health benefits, drinking too much can lead to several negative side effects, primarily due to its caffeine and tannin content. Here are the negative impacts of drinking excessive amounts of tea. 1. Caffeine-related side effects. Most teas, black, green, oolong, white, contain caffeine, and overconsumption can lead to typical caffeine overload symptoms: anxiety, jitters, and restlessness. High caffeine intake can overstimulate the central nervous system, leading to feelings of nervousness, anxiety, and an inability to sit still. Sleep disturbances, insomnia. Drinking too much tea, especially later in the day, can interfere with melatonin production and disrupt sleep cycles, leading to difficulty falling asleep or poor sleep quality. Rapid heart rate, palpitations. Excessive caffeine can increase heart rate, leading to palpitations or an irregular heartbeat in sensitive individuals. Headaches and dizziness. While caffeine can sometimes alleviate headaches, too much can lead to chronic daily headaches or dizziness. Caffeine dependence and withdrawal. Regular high intake can lead to dependence. If you suddenly stop, you may experience withdrawal symptoms like headaches, fatigue, and irritability. 2. Digestive and gastrointestinal issues. Tea contains compounds called tannins, which give tea its dry, astringent flavor and can cause digestive irritation when consumed in excess. Nausea and stomach discomfort. Tannins can irritate the digestive tract lining, especially when consuming very strong tea or drinking it on an empty stomach. Heartburn and acid reflux. Caffeine can relax the lower esophageal sphincter, allowing stomach acid to flow back up into the esophagus, causing heartburn or aggravating existing acid reflux/GERD symptoms. Constipation. In high amounts, the astringent properties of tannins may potentially contribute to constipation in some individuals. 3. Reduced iron absorption. Iron deficiency risk. The tannins in tea bind to non-heme iron, the type found in plant-based foods, in the digestive tract, inhibiting its absorption. If you drink large amounts of tea with meals, this can potentially lead to iron deficiency anemia over time, especially in individuals already at risk, e.g., vegetarians or those with low iron levels. Tip: to minimize this, drink tea between meals rather than with them. 4. Other potential concerns. Kidney stone risk, oxalates. Some teas, particularly black tea, are high in oxalates. Consuming excessive amounts may increase the risk of forming kidney stones in susceptible individuals. Teeth staining. The tannins in tea, particularly darker varieties like black tea, can cause discoloration or staining of tooth enamel over time. Pregnancy complications. Caffeine. High caffeine intake during pregnancy is associated with an increased risk of complications such as miscarriage or low birth weight. Pregnant individuals are advised to limit their caffeine consumption significantly. Drinking too hot tea. Studies have suggested a link between habitually drinking very hot beverages, above 65 to the power of circ C or 149 to the power of circ F, and an increased risk of esophageal cancer, regardless of the drink itself. This is due to thermal injury to the cells. For most healthy adults, drinking 3 to 4 cups, about 710 to 950 milliliters, of regular tea per day is generally considered safe and beneficial, but individual tolerance to caffeine and tannins varies greatly. The wound healing process is complex and requires increased nutritional support. Focusing on a diet rich in specific macronutrients and micronutrients can significantly speed up recovery and improve the quality of the repair. Here are the key food components and their sources that speed up wound healing. 1. Protein, the foundation of repair. Protein is the most critical nutrient for wound healing. It's necessary for building new tissue, producing collagen, and supporting immune function. Nutrient role. Key foods. Complete protein provides all essential amino acids. Lean meats, chicken, turkey, lean beef. Fish, salmon, tuna, shellfish, especially oysters. Eggs, dairy, milk, yogurt, cheese. Plant-based protein. Legumes, beans, lentils, chickpeas, tofu, nuts and seeds, quinoa. 2. Vitamin C for collagen synthesis. Vitamin C, ascorbic acid, is essential because it's required for the production of collagen, the main structural protein in skin, scar tissue, and blood vessels. It is also a powerful antioxidant and supports the immune system. Key foods: citrus fruits, oranges, grapefruit, berries, strawberries, kiwi. Peppers, especially bell peppers. Dark leafy greens, spinach, kale, broccoli, tomatoes. 3. Zinc. For tissue growth and immunity, Zinc is involved in numerous enzymatic reactions necessary for wound healing, including protein and DNA synthesis, cell division, and immune function. Key foods: red meat, beef, especially lean cuts, shellfish, oysters, crab, lobster, dairy, milk, yogurt, nuts and seeds, pumpkin seeds, cashews, legumes. 4. Vitamin A for immune response and cell growth. Vitamin A helps regulate the inflammatory response and supports the growth and differentiation of epithelial cells, skin cells. Key foods: orange and yellow vegetables, carrots, sweet potatoes, pumpkin, butternut squash, dark leafy greens, spinach, kale, liver, fortified dairy products. 5. Healthy fats, reducing inflammation. Healthy fats, particularly those containing omega-3 fatty acids, help control inflammation, which is a necessary but sometimes excessive part of the healing process. Key foods: fatty fish, salmon, mackerel, sardines, avocados, nuts and seeds, walnuts, flax seeds, olive oil. 6. Iron for oxygen transport. Iron is vital because it's a component of hemoglobin, which carries oxygen to the wound site. Proper oxygenation is crucial for tissue repair. Key foods: red meat, lentils and beans, spinach and other dark leafy greens, dried fruit, fortified cereals. General recommendations for recovery diet. Hydration. Drink plenty of water and unsweetened fluids. Fluid is essential to transport nutrients and oxygen to the wound. Calorie intake. Wound healing is an energy-intensive process. Ensure you are getting enough calories from a balanced diet to prevent the body from breaking down protein, muscle, for energy. Balanced meals. Aim to include a source of protein, a source of vitamin C, and other colorful fruits/vegetables, and healthy fats in every meal and snack. Always consult with your doctor or a registered dietitian for personalized advice regarding wound care nutrition, especially if you have a large wound, chronic health conditions like diabetes, or are recovering from surgery. The time after dinner is perfect for winding down, aiding digestion, and spending time on relaxing or enjoyable activities. Here is a breakdown of things you can do, categorized by focus. 1. Activities for health and digestion. It's best to avoid lying down immediately after eating, as this can slow digestion and cause acid reflux or heartburn. Take a short, gentle walk, 10 to 20 minutes. This is one of the best things you can do. A light walk aids digestion, helps regulate blood sugar levels, and is good for the heart. Drink herbal tea. Sip on non-caffeinated herbal teas like peppermint or ginger, which are known to soothe the stomach and aid digestion. Do light chores. Washing the dishes, wiping down counters, or prepping things for the next day keeps you upright and moving gently without strenuous exercise. Brush your teeth. Taking care of your dental hygiene is a simple way to signal that the day's eating is done. 2. Relaxing and winding down activities. The evening is an ideal time to de-stress and prepare your mind and body for sleep. Read a book. Curling up with a physical book is a great way to relax without the blue light from screens. Listen to a podcast or audiobook, enjoying a story or learning something new while relaxing on the couch. Light hobbies/craft. Engage in low-effort activities like knitting, crocheting, drawing, or coloring. Take a warm bath or shower. This can be very relaxing and help lower your body temperature slightly, which is beneficial for sleep. Journal or meditate. Spend time reflecting on your day or practicing mindfulness to clear your mind. Listen to music. Put on a relaxing playlist to set a calm mood. 3. Social and fun activities. This time is great for connecting with others or pursuing entertainment. Spend time with loved ones. Have a relaxed conversation with family members or roommates, or play a low-key board game or card game. Watch a movie or TV show. Catch up on your favorite series or watch a film. Try to limit screen time in the hour before bed, though, if you struggle with sleep. Work on a puzzle. Jigsaw puzzles or crosswords can be an engaging, low-stress activity. Go out for dessert/coffee/tea. If you enjoy leaving the house, a short trip out for a small treat or a relaxing drink is a pleasant option. Tip: if you plan to go to bed within the next few hours, choose activities that are calming and not overly stimulating. Avoid intense work, strenuous exercise, or highly exciting video games. Swimming for excessively long periods, especially frequently, can lead to several negative impacts related to overuse, chemical exposure, and general health. The main negative impacts include: 1. Overuse injuries, repetitive strain. The repetitive motion of swimming strokes can put significant stress on certain joints and small muscle groups, potentially leading to chronic pain and injury. Common issues include swimmer's shoulder, pain and inflammation in the shoulder joint and surrounding tendons, often affecting the rotator cuff. This is a very common complaint among competitive and long-distance swimmers. Swimmer's back, strain or pain in the back, often due to compensation if the core and hip muscles are not strong enough to absorb the forces generated by the stroke. Knee pain, particularly in breaststrokers, the repetitive kick can lead to overuse of the knee joint. Bone stress injuries and muscle strains, and fatigue in smaller muscle groups. 2. Respiratory issues. Exposure to pool chemicals, particularly chlorine and its byproducts called chloramines, formed when chlorine reacts with sweat, urine, and other organic matter, can irritate the respiratory system. Chlorine cough or swimmer's asthma. Frequent exposure to chloramines, especially in poorly ventilated indoor pools where the fumes are concentrated near the water's surface, can trigger coughing, wheezing, and potentially exacerbate or contribute to the development of asthma, particularly in competitive swimmers. Irritation of the nasal passages and throat. 3. Skin, hair, and eye issues. Prolonged exposure to chlorinated water and other contaminants can cause skin irritation, dry, itchy skin, and the potential to worsen conditions like eczema, often referred to as irritant dermatitis. Eye irritation, red, stinging, or dry eyes due to chlorine washing away the eye's protective tear layer. Hair damage. Chlorine can strip the natural oils from hair, leading to dryness, brittleness, and potentially discoloration, e.g., a green tint in light-colored hair due to oxidized copper in the water. 4. Ear and teeth concerns. Swimmer's ear, otitis externa. Prolonged water exposure can remove protective earwax, leaving the ear canal vulnerable to infection. Tooth erosion. Pool water with an improperly balanced pH, too acidic, can lead to the erosion of tooth enamel, which is a risk for very frequent and prolonged exposure. 5. Other potential risks. Infections. Exposure to germs, bacteria, or parasites in the water, both pools and natural bodies of water, can increase the risk of illnesses like diarrhea, e.g., from Cryptosporidium, skin rashes, and other infections. Exhaustion/overtraining. Long, frequent, or high-intensity sessions without adequate rest can lead to overtraining syndrome, which includes persistent fatigue, decreased performance, mood disturbances, and increased susceptibility to illness.